Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is on the NCLEX questions and the process behind them. You can find me on social media on Instagram, Pinterest, Nursing KAMP, nursingkamp.com. Okay, nurses, first tip. Delegation. In the previous question set number 2, I talked a little bit about delegation, and that generally we do not delegate anything that we can evaluate, things that we can teach. More importantly, we never ever delegate new admissions, transfers in and transfers out, and anything that we're teaching or educating. Because a maternity nurse wouldn't know specifically, this is general, about cardiac procedures. So it's always the basic medical surgical things. However, when a maternity nurse comes into a floor, like a cardiac floor, we only give them med-surg like patients. We never give them anything that has to do with cardiac. Unless, of course, it's a patient that might present on a regular med-surg floor. So that's an add-on to the other delegation. So in addition to that, that maternity nurse will never get a new admission, a transfer in or out, or have to do any sort of education or teaching. Okay, let's get into it. The first question. All right, first question. Quinapril, or Acupril. It's prescribed as adjunctive treatment for heart failure. After administration of the first dose, the nurse monitors which of the following most closely. All right, well, this is an ACE inhibitor. And in my previous lecture, I talked about ACE inhibitors and major things that we monitor with ACE inhibitors. That is angioedema. So if the person really gets swelled face, can't quite swallow, that's an airway problem. That's acute. Next thing is a cough. They start to cough. And then generally a switch to an ARB. And that's covered in my ACE inhibitor lecture. And then electrolytes. More specifically, ACE King high. So potassium high. So we'd monitor the BNP and this potassium. And looking for high. And high is acute because of cardiac arrest. And peaked T waves. Okay, so we have some content. And let's get into the question. Okay, Quinapril, ACE inhibitor, prescribed adjunctive therapy for heart failure. Okay, thank you for that. You're administering first dose. Okay, first dose. So let's talk about blood pressure pills and first dose medications. All right, so the principle is that whenever a person has a first dose, they're at risk for orthostatics. And this is because the renin-angiotensin system. Okay, so in the renin-angiotensin system, it's like they're running down a hill. And I covered this in my ACE inhibitor lecture. But what happens is as the momentum is going, the ACE inhibitor stops it right here. So there's momentum going, so you get this rebound hypotension. And that's acute, decreased blood pressure. Also, if they're on an ARB is even worse, where we call that orthosartan. Ortho because orthostatics are the most acute with ARBs, like losartan. That's why it's called sartan. And the reason that is because of, with orthostatics, the ARBs work in the renin-angiotensin system. So the ACE inhibitors stop the person from the top of the hill. However, ARBs stop the person. They've already been running down the hill. And they stop them right about there. And then they get severely orthostatic. That's why we give the medication at nighttime when they're sleeping. And we don't want them walking around because they'll fall on their face. All right. So first dose, there's the risk. Nurse monitors for which most closely. All right, so let's talk about it. Weight. Okay, well, weight is an issue for heart failure, but generally only on a phone call. And that is generally because of weight gain, 2-pound weight gain. But not generally for a first dose. It's going to take a little while. Weight is chronic over time. All right, next one. Urinary output. Okay, well, a lot of factors affect urinary output. So which one is it? Okay. Next one is lung sounds. Okay, well, heart failure does have crackles. However, there's no differentiation between right-sided versus left-sided here. So it can't be that. And also, this is ACE inhibitors. ACE inhibitors are chronic, and lung sounds are generally acute. Okay, last thing is blood pressure. Well, there you go. Right? Orthostatic hypotension, we worry about that. And because of first dose. And first dose is usually given at nighttime because of the risk for falling in the daytime. Until they get regulated on it. And then once they get regulated, they are usually generally okay. So blood pressure is the credited answer. Okay, nurses. Next question. Nurse employed in the emergency department is assigned triage clients coming to the emergency department for treatment on the evening shift. The nurse should assign highest priority to which of the following clients? Oh, who do you see first? Who's the most unstable for us? That's called C, B, CAP. And that's a priority action. Please see my video on that, but I'm going to run through it on this question. It's an order of priority based on nursing process. And so we're going to run through it. So a client complaining of muscle aches, headache, and malaise. Is this a stable or unstable patient? They sound pretty stable. They're complaining, but they sound stable. So I'm going to get rid of that. If I was unsure about this malaise, I could say unstable. All right, next thing. Client twisted her ankle when she fell while rollerblading. Okay, that's a stable patient, broken bone. Oh, but Kevin, what about the PE that she might have and stuff? Not enough data. That's ahead of the question. Stay focused on the now, not the future. All right, next one. Client with a minor laceration on the index finger while cutting an eggplant. Okay, that's a bleeding, but it's minor. And it's a problem. They're not going to die from that today. So that's more in the future. So we get rid of that. That's a stable patient. So here we are. We're down to 2. We said that we would keep this malaise. And the last one is chest pain. Uh-oh. Chest pain. Who states he just ate pizza that was very spicy. Well, a lot of times with chest pain, they generally are denying that they're having an MI. And also, it's a question, right? Chest pain needs to be evaluated. That makes this patient, I don't know if they're stable or unstable. So they're unstable. And is this expected? That's the next thing. Is this expected or unexpected? Okay. This is unexpected. He just ate pizza. So why does he have chest pain? Okay, so this is a priority action. And this one goes away. Because this patient needs to be seen and needs to be assessed. CB-CAP is an important process because it's nursing process. Please see my video on that where I cover that process in depth. Okay, my name is Kamp. This is Nursing Kamp, and this is part of my NCLEX Kamp question sets where I'm covering NCLEX questions and walking you through them and looking for tips and everything else. You can follow me on, this is Nursing Kamp, you can follow me on Instagram, Facebook, Pinterest, and on Etsy, also on nursingkamp.com. That's it for today. Nurse on.